Hello, my name is Dr. Hillel Mazansky, specializing in guided visualization or meditation, medical hypnosis, nutrition and exercise, my mantra being, one of them anyway, the mind causes all one's physical and psychological illnesses or conditions. If the mind causes it, which it does, the mind can help heal or treat it using medical hypnosis, guided visualization, nutrition, and exercise. Today we're going to discuss something that we've never discussed before, and the reason being it's not very common to get this, and it's called an autoimmune disease. An autoimmune disease means when the body attacks itself, antibodies from your own body system attack your organs, and an body antigen reaction occurs and you become ill. Example, an allergy. When people are allergic to something, one or other, whatever it may be, something they inhaled, something they ate, they can get one of a number of symptoms. They might get an asthma attack. They might start sneezing. Their noses start running. Their eyes start tearing. Or if they don't get that, they may get hives or rashes, joint pains. Those are the common reactions that one has because it's not extremely serious. Patients might feel ill and debilitated, but it's not really disease, it's a reaction. How about now, if your own body begins attacking itself, taking your antibodies which fight diseases, viruses, toxins, bacteria, viruses, etc., start attacking your own body. And that's what we're going to discuss. There is a whole litany of autoimmune diseases, but I'm going to, in the interest of time, I want to be brief, and we will discuss three. One is lupus, or LE. That's the most common one known, lupus, because it occurs most commonly. The next is sarcoidosis, and I'll explain each one. And the third is thyroiditis. Begin. Lupus. Lupus erythematosus is the full medical name. Presents itself with one or more of these symptoms, such as night sweats, joint pains, fever, weight loss, enlarged glands, a numbness in the hands or arms or legs, weakness. Oftentimes what happens in this lupus reaction, little granules of connective tissue form in different types of organs such as the brain, the eye, the lungs, the liver, the kidneys. Any organ can be affected, and then one specifically gets the specific symptoms or signs of that specific organ if it's affected sufficiently. The next thing is sarcoidosis. What is sarcoid, or known as sarcoid? Form again little granules which tend to be bigger than those of lupus, and patients present with the same symptoms, but also they have more of an enlarged glands in their neck and specifically in their lungs. Now again, if this gland enlargement or these nodules don't cause any symptoms, the patients are totally unaware of these nodules being present, and they might be diagnosed serendipitously. In other words, a patient might be going in for a routine chest x-ray because of immigration or something like that, and these lung nodules, large glands, are found. Or they might have a concussion, and then they go for a brain scan or an MRI, and all these nodules are found. So I think you understand what we're trying to say. In both cases, no treatment is usually given unless the symptoms persist or the glands enlarge, or in the brain it encroaches on an area which gives the patient severe pain or discomfort or anything like that, severe headaches. Then the treatment is usually steroids, cortisone. That's the only one we use. And depends the length of time. Sometimes, as I say, these diseases resolve by themselves and you never even know that you had it. Or if you start treatment, it can clear up, but it can return. So the patients need to be monitored. In sarcoidosis especially, one tends to do a biopsy if it's in an area where the patient will not suffer any damage from the biopsy. The third case is thyroiditis. Now, this is not the usual overactive or underactive thyroid that you see every day. Here, the antibodies in your body have attacked the thyroid gland only, which becomes very swollen and hard. Sometimes the doctors even think it might be cancer. But when they do further tests, they find it is thyroiditis, presents with underactive thyroid, and can clear by itself, but sometimes, again, cortisone is used. The general blood test that we use for different types of autoimmune diseases, it's non-specific. It's called an ANA, anti-nuclear antigen. The normal value is about 10, and if the ANA is raised to 20 or 30 or in the hundreds, then one knows that there is a autoimmune disease. The sedimentation rate is also a blood test that we use, and if that's increased or the blood settles away from the serum very quickly, resulting in a positive ESR, erythrocyte sedimentation rate, then those are two signs, and the doctors usually go further with various types of x-rays and tests. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.